Hello, my name is Cordula Ahnhudt-Franke. I'm a dermatologist born in Germany and working in the beautiful island of Mallorca, and I have specialized in aesthetic dermatology and laser dermatology. We are going to treat our 41-year-old patient. She has the initial signs of skin aging, of photoaging, with lots of lentigos on her chest, also some redness, also the first loss of elasticity. So she will benefit from the IPL treatment in combination with the 1940 Frax treatment. On her chest, you know, the age spots, the lentigos, solaris, so this is due to chronic sun exposure. We do see also some vascular components, so which makes the skin appear a little bit blotchy, a little bit reddish, a little bit brown, and this is something we would like to improve. My approach for today will be that we are going to use the SWT IPL technology with the VL555 handpiece because the skin on the chest is quite a delicate skin, so we need to be careful with our settings so we don't work as aggressive as we do on the face because the skin needs some special requirements. Our patient, she is about Fitzpatrick 2 skin type, and her skin is slightly tan, but it's not a fresh tan, so it's a tan from the summer. This is what we experience all the time from our patients, yes, because they are still spending time in the sun, but always protected. So it's skin type 2, she has low suntan, and we choose the diffuse redness and pigment mode with a double pulse, 9 joule divided in 2 pulses with a 10 milliseconds delay. On the chest we always need to be a little bit careful, yeah, because the skin is much more delicate, so I always do a test. Here we are. And then what I do is I watch the reaction of the skin. And we can see here a clear change of the color on the lentigo. So this is exactly what we are expecting from the treatment. This is an untreated lentigo here, and this is the treated one. So we see clearly the oxidation process of the lentigo, and this is our endpoint. This is exactly what we would like to reach without too much redness around it. So I do feel comfortable with this setting, so now I try to be quite quick. In the meantime, we can cool already the tissue. And we start with one pass. I always advise my patients, please let me know if you would like a break. Otherwise, most of the patients like me to treat them quickly. So now we need to be very careful because we reach now the bony structures above the clavicula. Yeah, so on bone we have a higher absorption of energy, of heat. So I try to be always perpendicular to the bone so that we do not create too much heat with one shot, yeah, to avoid a burn. Yeah, so we have a great change of color, yeah, a great darkening. This is something that we advise our patients. This darkening process will take about 7 to 10 days to disappear on the chest. It always takes a couple of days longer than on the face. And otherwise, there is no wound, there is no swelling, there is no, let's say, discomfort apart from the next maybe 1 or 2 hours where people do experience a little bit of heat, but we are going to apply a very nice calming mask. This is something that we advise to use at home also in the next 24 hours, so people can follow their normal activities, of course with sun protection, but pretty straight away after the treatment. Yes, so I think for the chest, super important is really not to over-treat, not to use too aggressive settings, because the skin is sensitive on the chest. Yes, and we have the bony structures, especially if somebody is rather slim and rather bony, so it's very important not to over-treat. We always try to educate our patients in focus on the décolletage and on the hands at the same time as on the face, because otherwise we see quite a difference between the changes on the face and on the rest of the body, and this doesn't match at a certain point. So that's why it's so important really to treat those areas as frequently as we do treat the face.